Let's review some documentation issues that we have been struggling with. There have been quite a few changes to the NG2 policy, so we're going to go over those changes and documentation. These are the changes that were made to the NG2 policy. So let's first look at B. Initial gastric tube placement should be verified in all adults and pediatric patients by obtaining an order from the physician for an X-ray or KUB. So doing audits, we have not been doing this. So upon initial insertion, we must obtain an X-ray. After the X-ray has been confirmed, you need to get an order from the physician stating that it's cleared for use. So yes, the physician needs to be the one that clears that NG tube before we can administer meds or give feeds. Then you want to mark the tube at its exit site from either the nose or the mouth, and then you want to document it with an iNet. Okay, now let's look at this one. These changes were made that once a shift, you need to verify tube placement by pH testing. Okay, if your patient is receiving tube feeds, then you can use site marking as your confirmation. But other than that, we need to be doing pH testing at least once a shift to verify placement. The GastriCult is the approved test for your gastric pH testing. Follow the instructions on the card. You will only need to use the pH test area for your gastric pH testing. If the patient is greater than 1 year of age, you will not have the option to select auscultation as a confirmation method. Okay, it is acceptable for 1 year and younger. But notice if the patient is older than a year, you will not have that option to choose auscultation. If the patient is greater than 18 years of age, you will not see the option of aspiration as a confirmation method. Okay, so there's the example of 1 to 18. You do see aspiration. And over here, the patient is 18 and over, so you will not see the option of aspiration. The only acceptable methods are pH testing, site marking, and X-ray. When pH testing is performed, you will get a task on your task list to go and document the results. This will always drop a charge, but remember, pH testing should be completed once a shift unless the patient is on continuous feeds. This task will take you into iNet to complete the pH testing documentation. Initial NG tube, OG tube must be confirmed by an X-ray. So this is what the order looks like. Notice that the policy is actually connected to the order as a reference text, so you can go back and look at it. And in the special instructions, you can even see upon insertion, confirm placement by chest X-ray or KUB. Once the X-ray has been taken and cleared by the physician, you need to place the clear for use order. This is just like the PICC order. You shouldn't infuse medications or tube feeds if you have not placed this order.
Compliance of the patient identification band on your patient is an issue. This band must be on the patient. It does not need to be in your pocket or on a clipboard. You need to scan the patient and the wristband on the patient when administering medications. Some medications may have more than one barcode. If the first barcode you scan does not work, then just scan the second one. In this example, you can see on the Rocephin that the correct barcode to scan is the bottom one. If you scan the top one, it will give you an error. Try scanning the second one and then it should work. You'll notice that all the correct appropriate barcodes will have the letters NDC underneath it, but the take-home message, if one doesn't work, try the other. For products that are dispensed from our pharmacy, they will place a label on them, and you can see the UMC logo. That is the correct label to scan. The one that is on the product from the manufacturer, that is not the correct one to scan. If there was a label created by pharmacy, that's the one to scan. Another issue are alerts. So we're just encouraging you to pay attention to alerts that fire. They're very important. If you get an alert, do not ignore the warning. Please read the alert thoroughly and act appropriately. This alert that you see here, the medication scanned, is not within the Medication Administration Wizard task list. This means that you either have the wrong product, the wrong form of the product, or it's not ordered for your patient. If you get this warning, do not give this medication to the patient. This is an example of a medication error that has occurred because the nurse ignored the alert. This medication that was ordered was metoprolol 50 milligrams. What was given was the extended release. That is not the medication that was ordered, so therefore it is a medication error. If you get this alert and you call pharmacy and they let you know that it is an approved substitute, please ask the pharmacist to change the order on your MAR to reflect what you are expected to administer.
If you are giving your patient the meningococcal vaccine, you need to scan the medication with the orange cap.
When giving any medication on the pump, you must follow the BAM process as well as follow the auto pump programming steps. The next few slides will walk through this process of auto pump programming. One thing to be aware of is when programming your pump, always select the appropriate profile. The association feature we're going to talk about today will not work if you're in the wrong patient profile. Before programming your pump, verify the green light indicating wireless connectivity. With auto pump programming, we want to follow the BAM steps just as we do for all medication administration. You're going to click or launch the Medication Administration Wizard, scan the wristband, make sure the tubing is in the pump, ready to go, scan the medication, complete all required fields, then stop. You have to complete the required fields before you can scan the pump. You want to slow down, don't select OK yet. Now it's time for the 2 steps to program. That's when you want to click on Program. Once you click on the word Program, it should say Ready to Scan the Pump. Make sure it says Ready to Scan Pump before you scan the pump. Scan the 2D barcode located on the module. This will upload the medication to the pump and associate the med pump in PowerChart. Verify on the screen and on the pump that it programmed correctly. A benefit to auto pump programming is that it programs the pump within the appropriate guardrails and it programs directly from the order. Once you have scanned the pump, it will indicate that it's programmed waiting confirmation. The start button is the confirmation. Most of the staff are signing off the drug before starting the pump, and this is not correct. You must hit start on the pump in order for auto pump programming to work. The Start button is the confirmation. Once you have hit Start, you should see the green Go Ahead light that indicates everything is correct. You'll see the volume highlighted in green and the rate highlighted in green. It will also have highlighted that the pump is infusing. It has been confirmed. Once everything is correct, then you can click OK. Notice it will be bolded with the blue check mark, so now you can click on Sign. All of the volumes from the pump will then flow into the infusion management window. IV piggyback medications. When hanging IV piggyback infusions, the nurse should first make sure that the patient has a primary infusion already associated to the module before trying to associate a secondary. All IV piggyback medications should have a carrier fluid. To look up what medications are associated, you can click on the Associated Device to Patient icon. It is also located in iNet or in Infusion Management under the Patient Device Association window. You can also tell on your MAR if a medication is associated by this icon. So step 1, you want to open and launch the Medication Administration Wizard. Scan the patient wristband. Scan the medication that should be loaded in the pump, tubing ready to go in the pump. Click on Program. Make sure it says Ready to Scan Pump before you scan the pump. Then 6 is to scan the 2D code on. After you scan the pump, you will still see the word primary until you select secondary. You want to select secondary on the pump. After you select secondary, you will see the medication program in the window. Then you will select Next. Verify pump programming. Verify that the secondary clamp is open and press Start on the pump. You want to sign off the medication in the MAW. You should see the green highlighting indicating successful auto pump programming. The pump will auto revert to primary fluids once the secondary infusion completes. If you forgot to click on secondary and you've not yet started the pump, then the programming can be canceled from the pump and then the pump rescanned to program correctly. Another quick fix: if the nurse gets this error and the pump did not auto-program, say no to this error, close out of the medication window, canceling the charting. Try it again, rescan the medication and the pump, and it usually will reprogram. If it still was not successful, please let us know. Write down the medication, the module number, the patient, the error that occurred, and the time the error occurred, and email to Tara or Sarah, please.
Guardrails. If auto pump programming is not working, just make sure that you are manually programming your medication using guardrails. You should only use basic infusion if the drug is not within the drug library. If that's the case, you need to let your administration know so that they can contact pharmacy so we can get that medication added to the drug library.